mental health in the Marine Corps, you talk about it with like your best bud. You don't mention it outside your room, you just don't talk about it. I was afraid to admit that I had PTSD.
So we lose 22 veterans to suicide a day.
I've been dealing with childhood trauma for almost 5 decades.
I'd been in therapy a couple of times, didn't really work. I felt like it was just an hour a week or a couple hours a month of giving people money because there wasn't really any result of it.
Because it works. Doesn't work for every single person, nothing does. But what we see happen in people's lives is really what keeps us doing this.
All right, you've really got to let go during the psychedelic journey, because how do you prepare somebody for entering into the mystery? But the parallel, obviously, with terminal illness and life-limiting illness is that none of us know what death is like.
So the role of psilocybin at the end of life is that if we're able to take away the anxiety, then we can really step into life and having quality of life, which is what end-of-life care is.
We're touching people's souls, or they're so vulnerable, and it's really such deep work that people need to have high ethics if they want to be involved. It's critical so that we're not harming anybody. Just for the basic do no harm.
Something that I think is important as we have this conversation is weaving in the aspect of ethics.
I really want people to take this seriously and to recognize that there's a double edge to all psychedelics. They can be deeply healing. There's also the potential for there to be fragmentation and harm.
Seeing how working with psilocybin and some of these other medicines can actually bring that relief, that might have otherwise taken years of conventional therapy to get to, is amazing. When a person who's had issues from their past, that they can't let go of in the present, and it shows up in their lives in terms of anxiousness or pain or depression and so forth, when they find relief from that, there's hardly anything more rewarding, than that. As a therapist, that's why we get into that.